Advanced assessment of mental health disorders, health history. Certain basic principles guide the clinician in obtaining the most accurate mental status assessment. A quiet, private, and unhurried environment will reduce barriers and facilitate conversation about more personal psychosocial issues. Appropriate eye contact, attentive body language, a pleasant and natural vocal quality, impeccable listening skills, and continual evaluation of whether verbal reports match or reveal discrepancies are essential. Using an unhurried pace, exhibiting well developed listening skills, and attempting to clarify for the patient what he has stated communicate caring, empathy, and compassion. The environment, setting, and the mind frame of both patient and clinician must be factored into assessment of mental status. Warmth, genuineness, confidence, appropriate use of humor, and an empathic link felt by patient from the clinician can enhance the assessment. Barriers include interrupting, belittling, moralizing, failing to provide privacy, and lacking consideration. Environmental temperature, fear, anxiety, hunger, pain, or a rushed schedule can also negatively affect the mental status data. For example, performing the assessment at the time of admission, discharge, or following negative news may cause mental status examination results that do not typically represent the patient. Interview technique and communication is especially important when assessing mental health. It is important for the practitioner to reassure the patient who presents psychosocial, the psychiatric mental health information that she considers symptoms to be understandable and within a normal range. For example, the clinician may say, some people have experienced sexual side effects from this medicine but never mentioned it. Please let me know if this medicine causes such a problem so we can explore other medication options and ways to cope. An additional strategy is to make transitional statements connecting information from the medical part of the interview to a current psychosocial topic. For example, if the patient speaks of how difficult it is to go on and cope with certain types of illness, the practitioner can follow up with questions about levels of depression and thoughts of suicide. If a patient speaks of needing alcohol to get to sleep, follow up questions about amount and history of alcohol use can follow. Even if the patient denies presence of mental health issues, seeds have been planted regarding the clinician's interest and willingness to learn, to listen, and intervene in such issues. The patient may feel relieved that the practitioner is interested in a holistic approach regarding both medical and mental health issues. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition text revision, DSM-5-TR, is the authoritative book that provides a common and definitive language for mental health practitioners to evaluate, treat, and monitor psychiatric problems. It includes guidelines for assessing selected mental health conditions, some questions to use if abnormal mental status is suspected, and specific criteria used for further evaluation. Thank you for your attention.